This is Dr. Sonia Dhoot, and you're watching this video because you have been diagnosed with a macular hole. A macular hole is a hole in the macula, which is the centralmost portion of our retina. This usually happens as a result of the vitreous jelly in the back of the eye separating from the retina. The vitreous, when we're born, is really solid and firmly attached to the retina. And as we get older, that jelly undergoes liquefaction changes and eventually separates from the retina. 85% of the time it separates without any trouble, but 15% of the time it can cause problems as it's separating, and one of those problems is a hole in the macula. Unfortunately, there are no drops that we can do for this. This is a surgery problem to fix. The surgery doesn't exactly close the macular hole, it sets up the conditions for the hole to close on its own. The surgery is outpatient surgery and it takes about 40 to 45 minutes under local anesthesia. You will have an anesthesiologist in the room who will be giving you sedation through your IV so you'll be comfortable, but you're awake during the surgery. We make 3 very small incisions on the white part of the eye, about the size of the tip of a pen. The first trocar or incision is to provide infusion to the eye to keep the eye inflated while we work. The second is a light so we can see what we're doing. And then the third is an instrument that we're using to do the work we need to do. The first step in the surgery is to lift and remove that vitreous jelly, which is causing the traction that's keeping that macular hole open. The second part of the surgery is to peel the innermost layer of the retina, which provides horizontal traction to keep that hole open. The third part of the surgery is inserting a gas bubble into the eye to act like a balloon and help close that hole. That's the easy part of the surgery. The hard part is what we ask you to do afterwards, which is to keep your face down for 5 days after surgery. We ask you to be face down for about 90% of the day, and you can sleep on either side with your nose touching the pillow. The day of surgery counts as day number 1, and then 4 days afterwards. There is equipment that we can have you rent that allows you to stay in this face down position a little bit easier. You will be on eye drops for about a month after surgery, and you'll be asked to not do any heavy lifting for about a month after surgery. Through the gas bubble, the vision is very, very blurry. It's like looking underwater, but slowly that gas bubble gets smaller, and as the gas bubble gets smaller, you're able to see around the bubble. With a gas bubble in the eye, which every patient is a little bit different, but usually lasts for about 6 weeks, you cannot go up any altitudes while that gas bubble is in the eye. That means no driving up to Las Vegas, driving up north, getting on an airplane, any altitude more than about 3,000 feet. There is about an 85 to 90% chance that the hole will close with good positioning. Assuming that the hole does close, the vision can take all the way up to a year to reach its maximal potential. If you close your other eye, there's always going to be something in the center that you can't quite see clearly, even with a closed hole. The goal is to make that spot as small and as transparent as possible, and that hopefully with both eyes open, your other eye will work to fix any defect that your macular hole eye had, and you don't notice it on a day-to-day basis. If you have not yet had cataract surgery, doing this surgery will accelerate the growth of the cataract. Not really a huge deal because eventually everybody needs cataract surgery, and once it's out for life. This is not an emergency, but it is time sensitive. We know that the longer the hole stays open, the lower the chance that it closes and the less useful vision you will regain. So we usually like to do your surgery within a few weeks of diagnosis. Risks of surgery are risk of the hole reopening, which is about a 5% chance, risk of retinal detachment, infection, or bleeding, which all together happen 1% of the time.